Ed Thomas from Camdenton. We need more, not less, Medicare and Medicaid for help for our disabled people in Missouri. Thank you. Thanks for that. Yeah, the bill, the healthcare bill is, you know, first let me start out by saying the goal of the healthcare reform was to try to figure out a way that people could buy insurance that didn't have insurance at work. That was a big problem in our country. When I campaigned the first time, everyone said, especially farmers, we got no place to get insurance. I got to send my wife in to get a minimum wage job in town at this one place because they have health insurance just so we can have insurance. A lot of 100-year farms told me that it was keeping their kids from staying on the farm so they couldn't get health insurance. So I knew going in that a big problem was that people who didn't have insurance at work didn't have a place to go to get it. So we tried. And you know, there's mistakes that were made, no question. There's fixes that need to happen. And we've got to figure out a way to make it work when people need to buy insurance that they don't get at work. But what they propose to do is not really going to help with costs at all. And let me lay this out so that you kind of get the challenge here. They're struggling, frankly, like we struggled, because this is hard to figure this out. Let's see, Ed, what do you do?
Manager of accounting for Senate Bill 40 in Camden.
Okay, so let's assume that somebody who works for Ed or someone else here is 27 years old. And they've got just enough money they're making that they can either buy a health insurance policy or a Harley. Well, pretty sure I know what they're going to buy. They're going to buy the Harley. And then let's say they get up here on 54 and get cut off by an 18-wheeler on their way to Jeff, and they have traumatic brain injuries. And we life flight them down to Cox in Springfield, and when they meet him at the door of the emergency room and he's got traumatic brain injuries from this motorcycle accident, nobody stops him and asks him, I'm sorry, you can't come in, you didn't buy health insurance. He comes on in the emergency room. And they give him $2 million, $3 million worth of traumatic brain care. And of course, he goes bankrupt immediately. He can't pay those bills. So those bills sit on the hospital's books at the end of the year under the category of uninsured care. When we began down the road of the ACA Act, we were trying to figure out how to deal with that big number of uninsured care, because you know what happened at the end of the year with all that uninsured care? They called the insurance company. And they said, insurance company, you are our customers, and we're going to have to charge you more for labor and delivery, and for an angioplasty, and for knee surgery, because we've got all these people showing up without insurance. And then that insurance agent then calls the business down the road and says, guess what? Your premium's going up 15% next year, because I got to pay the hospital more for their uninsured care bill. So what's happened is, by that young man buying a Harley instead of health insurance, guess who paid for it? We all did. It's really not that different than having to buy car insurance. Because when you think about why you have to buy car insurance, you have to buy car insurance because you could hit somebody else and have liability, and they want to make sure you can pay for damage to their car. Well, we're paying for damage to his health. It's no different. And by the way, you can go bankrupt a lot quicker with a cancer diagnosis than you will with a car accident. A lot quicker. So how do we get that 27-year-old into the insurance pool? Now, nobody liked the idea of telling me he had to go. I know Missouri. You know, not trusting the government, not wanting the government to tell us what to do is in our DNA in Missouri. So nobody liked the idea of us telling people they had to get insurance. So that's really what the problem is. Now, imagine if we do what the Senate's planning on doing, the Republicans, they're going to say you can still get insurance when you're sick. You may have to wait 6 months, but you can get insurance. You don't have to get no more mandate to get insurance. Well, now who's going to get insurance before they're sick? Why would you? Right? So who's going to be in the pool? Sick people. And are the bills going to be high or low? The bills are going to be very high. So guess what's going to happen? Those premiums are not going to come down. It just defies common sense that the premiums would come down. And in fact, the premiums they're setting on the bill they've written are higher than the ones you've got now. right now in Miller County, a 60-year-old man that makes $30,000 a year pays $2,480 for the silver plan on the exchanges if he doesn't get insurance at work. $2,480 in premiums. Under the Republican Senate bill, he'd pay over $4,000. So I've got ideas on how we can make the exchanges better, like a copper plan that would be even cheaper, that would be free prevention, high deductible, and only kicks in if you have something catastrophic like cancer or a car wreck or a motorcycle accident. I've got ideas about automatic enrollment that you could opt out of. I've got ideas that for people between the ages of 55 and 65, how about if they're allowed to buy into Medicare? Right? Not that they would get Medicare, but they could buy into it. That way you're in a bigger pool, and that's the people that need the insurance the most, between 55 and 65, before Medicare does kick in. So we've got ideas if we would just get away from what they're planning on doing, which makes no sense to me. Makes no sense to me, because here's what they're doing. They're doing a tax cut of about $1 trillion. Now the biggest chunk of that tax cut is going to people who have investment income and make more than $250,000 a year. So it's millionaires and billionaires are going to get it. The average tax cut for a millionaire is $59,000 a year. And to pay for that, they're going to cut Medicaid. Now, Medicaid is not, people in Missouri that are able-bodied adults can't get Medicaid. The only people who get Medicaid in our state are disabled, children, and the elderly, and mothers of children. And by the way, 64 cents of every dollar that's spent on nursing homes in Missouri is spent by Medicaid. So if you've got nursing homes out in rural areas, they are really, really going to be compromised. I'm saying nothing of rural hospitals that depend on those Medicaid dollars. So I want to fix some stuff. I really do. I think we can make it better. But this idea is not a good idea. Turns out repeal and replace is harder than it looks. It's much harder than it looks. And, you know, so to keep the notion that most Americans support, that you shouldn't be able to discriminate against somebody just because they've had the nerve to be sick before, it depends on us figuring out how we get healthy people in the pool. And if we can't get healthy people in the pool, it's not going to work. It's just not going to work. That's why employer plans work, because everybody's in it. The healthy young people at work are in it, and some of the people that are not healthy are in it, and the healthy people pay the bills for the sick people. That's what insurance is.